Hello everyone, this is Dr. Shishma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about Polycystic Ovarian Syndrome, that is PCOS, and its relationship to endometrial hyperplasia. So many people, if you take 100 people who are suffering from Polycystic Ovarian Syndrome, out of that majority people do suffer from scanty, late or irregular periods. But there is a subset in PCOS where the patient or the person suffering from PCOS suffers from abnormal uterine bleeding, where the bleeding is heavy in nature and also irregular. So today we are going to talk about that particular abnormal uterine bleeding which is happening because of endometrial hyperplasia. So to give a better insight into this, we will be doing the explanation through screen so that you will have a pictorial representation and we will be able to explain in a much better manner. So let's dive into the topic to know more about it. Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about PCOS and endometrial hyperplasia. Many people who are suffering with abnormal uterine bleeding and who are suffering with PCOS have this common pathology. So let's discuss more about this. What is endometrial hyperplasia? If we take female reproductive system, uterus is one of the main parts specifically. So uterus is the main organ for baby development. It has this implantation process and the baby grows within the uterine cavity, right? So the uterus is composed of three main layers. The outer one is called as the perimetrium, the inside one or the muscle layer is called as the myometrium, and the inside layer, the red color that you're seeing, is the endometrium, right? So endometrial layer is very in connection with estrogen and progesterone levels in the body, right? As these levels fluctuate in the body, so does the endometrial thickness fluctuate, right? There are four phases in female reproductive system menstrual cycle. We can take that first phase is menstruation, where the body is bleeding or the endometrium is shedding off, and then we have the follicular phase, and then we have the ovulatory phase or the release of the egg phase, and the last one is called as luteal phase, right? So the endometrial thickness, after it is being shut down, again reforms under the influence of estrogen and progesterone. It waits for the fertilization, that is when the egg is released, the body is expecting to have a baby. That is why endometrial thickness will start building up from the follicular phase and it will thicken in the luteal phase, right? But what happens if there is no fertilization or if there is no as expected baby happening? So what will happen is the endometrium will start to shut down in the menstruation phase in the next month, right? But what is endometrial hyperplasia? By hyperplasia, I mean there is increase in n number of cells. That is, there are two ways to say that the cell is growing. One is hypertrophy, the next one is called as hyperplasia. What is hypertrophy? Hypertrophy means that the cell is becoming larger, right? But what is hyperplasia? The cell is starting to become a little larger and it is starting to divide and give baby cells, and these baby cells will mature and give rise to another baby cells. This process takes time, but in hyperplasia conditions where there is induced hyperplasia, the cells will start to divide repeatedly, okay? And when this repeated divisions goes out of control, this can lead into tumor like growths, fine? So what happens in endometrial hyperplasia is that because of hormonal imbalances, there is increase in number of cells in the endometrium. So the endometrium is becoming thickened. So that is the problem with endometrial hyperplasia. Is it abnormal? No. It is normal under certain conditions and it is called abnormal under certain conditions. So what are the causes where it should be called abnormal? We will be knowing. So we'll be discussing what are the causes which cause abnormal endometrial hyperplasia. The first one being hormonal imbalance. You have to understand endometrium is very viable to the levels of estrogen and progesterone in the body. Any sort of differences in this can cause endometrial hyperplasia. Second one is perimenopause and menopausal state, where there is hormonal imbalance physiologically, which can lead into endometrial hyperplasia. If the endometrial hyperplasia is going out of control, then in perimenopause or menopausal stage, then that can be taken into a pathological count, right? And the third one is PCOS, which is Polycystic Ovarian Syndrome, which has excess of E1 dominance, which is estrogen dominance, and progesterone drop. That is why we will be experiencing endometrial hyperplasia in PCOS as well. Apart from that, there are other diseases which cause endometrial hyperplasia. We will be seeing them, right? The next slide, which contains obesity. If you're obese either genetically or if you're obese due to stress and increase in cortisol level, can lead into an hormonal imbalance, and that can lead into endometrial hyperplasia, which is pathological. Okay, even PCOS is pathological, even hormonal imbalance is pathological. If perimenopause and menopause stage, if the endometrial thickness is more than 13 it is pathological. And then obesity is pathological, and then diabetes or insulin resistance can lead into hormonal disruption, which can lead into endometrial hyperplasia, pathological. Certain medications can cause endometrial hyperplasia, which is also pathological. And then other factors, like there are certain tumors in the body which can cause changes in the estrogen and progesterone level, leading into endometrial hyperplasia, which are adrenal gland tumors, or it can be cortical stromal tumors, or it can be granulosa tumors of the ovary. All of them can also cause hormonal imbalance and can cause endometrial pathological hyperplasia. What is PCOS connection with this endometrial hyperplasia condition? Right, so here we will be discussing in detail how PCOS can cause or can maintain endometrial hyperplasia conditions for a longer period of time. Right, you know that PCOS has GnRH pulsation differences, that is, there is difference in the release of GnRH. This causes release of, usually what happens is the brain secretes GnRH. GnRH helps in secretion of LH and FSH. Both of them help in ovulation, and then during the process of ovulation there is release of estrogen, and after ovulation there is a release of estrogen from corpus luteum by progesterone. Right, so what happens in PCOS, there is difference in secretions of GnRH, which causes LH to rise. You're understanding, right? Which causes LH to rise and FSH to fall down. So what happens if FSH is falling down? There is no maturation of the eggs in the ovary. Whenever there is no maturation of eggs in the ovary, egg is not released because there is no maturation. After egg is released, the excess one or the corpus luteum will secrete progesterone, right? If there is no egg itself is not releasing, that is anovulatory cycles, what will happen? The progesterone is dropped out. Because there is improper maturation of the ovaries or improper maturation of the eggs or the ovum as such in the ovary, what happens? Estrogen is there, and apart from that, estrogen is also secreted in abundance in the adipose tissue, that is in the fat tissue. E1 is secreted, so there is increase in E1 and drop in progesterone. Whenever there is drop in progesterone, what will happen? Estrogen hormone as such helps in getting the endometrial layer to get thickened, but progesterone also helps in shedding the layer, cutting down the layer and shedding it off, right? But whenever there is no progesterone, the thickness is not maintained. What happens is progesterone and estrogen, they work together so as to maintain the normal thickness. Whenever there is drop in this progesterone, or normal estrogen with drop of progesterone, or normal progesterone with increase in estrogen, any of these conditions, the endometrial layer is not properly forming. Right, whenever there is no proper formation and no check on its thickness, what happens? It becomes very thickened, and then what happens? There is risk for developing cancer in very rare cases. Okay, very rare cases it can develop into cancer, and that irregular endometrial thickness or too much of endometrial thickness can cause irregular bleeding, or as we call abnormal uterine bleeding. What are the symptoms of endometrial hyperplasia in PCOS? Is that if we are taking 100 people who are suffering from PCOS, 60 to 70 or majority of the people will be experiencing delayed periods, scanty periods, or late periods, right? But some people do experience abnormal uterine bleeding where there is heavy period. Yes, in PCOS you can have heavy periods, and you can experience mid-menstrual bleeding, that is bleeding between two periods, and then you can experience post-menopausal bleeding. This should be considered really well, because post-menopausal bleeding outcomes are not that good, although some can be expected, some cannot be expected. So if you are someone who has attained menopause and you are having post-menopausal bleeding, do take that into consideration, because it's really important. And then menstrual cycle, usually it is 28 days menstrual cycle. A healthy human or a healthy female has a 28 days menstrual cycle, and 28 days is not specific. You can plus add on 5 days or remove 5 days. Anything in between this range, plus or minus 5 days of 28 days is okay. It is considered healthy. But if it is occurring, if the cycle is occurring every 20 days, every 15 days, or every 45 days, every 80 days, then that is not considered healthy, right? So there is decrease in cycle days where the cycle duration is shortened to 21 days in some period. In some people, they experience even cycle in every 15 or 10 days. And then we have the other symptoms which are coordinating with the AUB symptoms, which is called as pain and cramping. Some people do experience pain, severe cramping in the hypogastric region, radiating to the back or extending to the anterior part of the thigh. Other than that, some people experience blood clots. This is very, very important. If you're someone who's suffering with abnormal uterine bleeding and you're experiencing with clots which are long and large and are very painful, do take doctor consultation as soon as possible, because there might be a huge drop in the hemoglobin level in your blood and you might need a blood transfusion, right? And apart from that, you will also experience anemic conditions because of the prolonged bleeding. Now coming to the conventional form of treatment or allopathic form of treatment, what would a gynecologist do or suggest you to do or take if you're suffering from PCOS, which is combined with endometrial hyperplasia? So they would first suggest you with progestins, which is a synthetic form of progesterone, so that your hormone balance is maintained. But as soon as you stop using it, you will have a recurrence of the symptoms, right? They will be advising you to use oral contraceptives. If not taken properly, it can cause mid-menstrual bleeding. It has side effects like bloating. It has GI effects. Some people do experience weight gain, hair fall, skin becoming a little bit oilier, and acne prone skin are some of the side effects of oral contraceptives. And if you're someone who is planning to get pregnant, then oral contraceptives might not be your choice of medication. And then we have metformin, which is given for diabetes condition. If you're someone who's suffering with superadded diabetes condition along with the PCOS and endometrial hyperplasia, metformin is given. But metformin on a longer run will cause muscle deterioration, as we can cause there is deterioration in the size of the muscle. Apart from that, there are surgical processes. If the condition is not getting control with the medications, they would suggest you two types of surgeries, the one being hysteroscopy with endometrial ablation and hysterectomy. You know hysterectomy, right? That is complete removal of the uterus. If you're removing the uterus before menopause, what happens? You will be experiencing decrease in your serum calcium levels, decrease in your estrogen levels, decrease in your progesterone levels. That will have an impact on your bone health, that will have an impact on your skin, impact on your hair, impact on overall immunity as well. You will be experiencing hot flushes, you will be experiencing severe mood changes, right? And then apart from that, you're someone who is thinking of getting a hysteroscopy with endometrial ablation, then this is for you. See, this is called an hysteroscope. It's an instrument wherein first a speculum is inserted into the vaginal orifice to enlarge the vaginal orifice, and then the hysteroscope is inserted, which has light or bulb in the rear end of it. So what happens is that with the hysteroscope, they will be locating what the problem is, and they will do endometrial ablation, which is called as removal of the endometrial tissue, excess endometrial tissue. But if you're someone whose hormones are not under control, you're having severe hormonal imbalance, then although you get this endometrial ablation done, you will experience, or you can experience, a recurrence of symptoms after 2 or 3 months of endometrial ablation, because I've seen cases in our clinic who have had recurrency in the endometrial hyperplasia even after getting endometrial ablation, and they've been told to get hysterectomy done, but they have not yet planned for another kid, so they have come to help for us. So situation can get complicated if you are not treating your PCOS in the starting stage, right? That is something that you have to understand, that do not super complicate your diseases, because it would be hard to treat in any system of medicine. Now coming to homeopathic form of treatment, you have understood how conventional form of treatment, if you stop using conventional form of treatment, then you will have recurrence of symptoms. They have side effects even while using, and apart from that, sometimes even after using also, if you do not get any proper expected way of prognosis, they will be advising you for surgery. Apart from all this hassle basil, you have a kind of medicine which is safe, which is effective, which can increase your fertility, which can understand the link between your mental thought process, your physical symptomatology, which can differentiate you from all your family members, which can individualize you, give medication which is specifically made for you, which will decrease your menstrual cramps, which will increase that menstrual cycle to 28 days, or keep it in a healthy balance between 28 days to 30 days, and then decrease the clot size, regularize your menses, and then give you a better result without any side effects. That is nothing but homeopathic form of treatment, and it helps in curing the symptoms, it helps in relieving your symptoms, and it helps in preventing furthermore recurrences of these symptoms. Now we get to the consultation part. We have understood how homeopathy is a better choice in lifestyle disorders. Now I'll be explaining to you how Fidicus homeopathy is much better choice. Here at Fidicus homeopathy, in consultation options, we have two kinds of options. One being online, the other being in person or the offline consultation. If you are someone who is staying nearby the nearest branch of Fidicus, you can come and contact us in person and take doctor consultation. If you are someone who is staying far away from us, you can contact us online either through audio consultation option or through the video consultation option. After taking doctor consultation and after carefully inspecting your investigation reports, especially to the online clients, medicines will be home delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. Apart from that, anywhere in the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us, WhatsApp us, or messages on us on this number. Apart from that, if you would like to know more about Fidicus homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from female reproductive organ diseases, then Fidicus homeopathy is the answer. Why should you be choosing Fidicus homeopathy? Because Fidicus homeopathy stands for highest chance of health, and here we follow 3 basic major principles. What are they? First one, we are experiencing high success rate in treating cases like endometriosis, adenomyosis, dysmenorrhea, cervical erosion, bulky uterus, endometrial hyperplasia, PCOD, PCOS, and even cases which contain ovarian cysts. So we're having high success rate in this. Apart from that, the treatment here is transparent. That is, there is no gray area between the patient and the doctor. We will be giving you a perfect picture of your prognosis as well. And then the personal care here at Fidicus homeopathy is top notch, because here we will be educating you on all the symptoms that you develop. Any of your queries or questions will be answered. So if you want to choose health, if you want to choose cure, choose Fidicus homeopathy. So today we have learned about how PCOS triggers or can cause endometrial hyperplasia. What are the symptoms of endometrial hyperplasia? And then what are the best treatment options for PCOS and endometrial hyperplasia? If you want to know more about PCOS, or if you want to know more about endometrial hyperplasia or any other female reproductive organ diseases, you can go to the comment section and comment whatever your query is. We will be answering you, or we will be doing a video on that. So meet you all in the next topic. Thank you.
Fidicus homeopathy.